Hello, and welcome to the Smart Injury Doctors Podcast, the injury market's top program for doctors, lawyers, and insurers who want to gain greater insight on how to improve patient recovery results and deliver better services in the U.S. injury market. Please welcome your host, Dr. Jeffrey Allen Kronk.
Hello, doctors. Welcome to today's program. Today, what I want to talk about is commitment. Commitment is huge. If you decide that you want to engage in a personal injury practice, and to me it's the most purpose-driven practice that you can have, whether you're a doctor of chiropractic, a doctor of osteopathy, a doctor of a medical doctor, a doctor of physical therapy, it doesn't matter. Injury patients need the best doctors in the market. They don't need to go to average doctors. They need to be willing and able to find the best doctors in the market. And the reason why they need the best doctors in the market is because they're at such high risk for long-term residual complaints. There's not an injury patient in the market today that shouldn't be going to the top 20% of any profession. So if they're going to choose chiropractic, they better choose the top 20% because their risk for long-term residual complaints is quite high. And today, with the markets the way that they are, in the future of the markets, those are the doctors that are going to be identified as those that should be matched with that injury patient. Those are going to be the doctors that are busy. So what does commitment mean? Well, it means dedication. It means application. Dedication and application. So dedication to learning, never stopping learning. That's one dedication that every injury doctor should have. Dedication to better diagnostic technique. Dedication to better diagnostic understanding, to be able to determine the severity and location of any injury that the patient has. Dedication on that, right? And then application. How do you apply that? Application of examination techniques. Application of examination techniques for simple spinal instability workups. But the other thing that a smart injury doctor does is he takes a course of action or a course of study, and then he studies it with high devotion. That means he's not studying anything else at the moment. Injury practices today should be, the best providers should almost be solely dedicated to bettering themselves and bettering their ability to deliver injury services. The injury patient doesn't deserve anything less than that. Now, there are a number of trainers in the market. I know in my profession, in the profession of chiropractic, there are different trainers. There's different personal injury trainers. Most of the time, the personal injury trainers are training you on either educating you for your CV to give you more advanced certifications, or they're educating you on office procedures, or they're educating you on diagnostic procedures. In the Smart Injury Doctors program that I developed, we're doing it on one area, spinal ligament injuries. We're teaching the doctors how to better diagnose these, examine these, so that they don't miss the injuries themselves, how to better manage, treat and manage the patient for better results, and then how to document everything in a way that anyone involved, insurer, attorney, patient, anyone involved, has access to any benefits that patient may be entitled to. So it's very, very simple. Our program then also helps the doctor to train his staff, and it helps the doctor to then market the uniqueness of their clinic. Now, if you're going to go with any program, you need to dedicate yourself to that program. All right, I see so many doctors will jump from program to program to program to program, and thinking that the pasture is always greener over here. This is what I don't know over here. This is what I don't know over here. And so they never really get the full benefit of the program that they're signed up with. Now, you miss out on that because you're not really committed. When you're committed to a program, you want to study that program over and over and over and over and over again. And you want to get absolutely everything out of it that you possibly can before you go to the next program. And today I see so many doctors will jump from program to program. They've done this training, they've done that training, they've done this training, they've done that training. And yet when I ask them simple questions about this training, that training, or the other training, they really can't answer them all that well. So if you're going to spend time and resources, then study it like you're going to become a professional with it, not a hobbyist with it. Don't take any program on as if it's a hobby, if it's something that you casually enjoy doing. And some doctors, actually, quite frankly, that I've met, enjoy studying, and they study, but they never apply. Remember, commitment is dedication to the study and enhancement of yourself in that area, but it's also in the application. So the place that you most learn, if you understand what's been taught, is in the area of application. Because if you can't apply it, there's something you don't know about it. If you can't apply it, there is something that you don't know about it. And you have to go back and you have to find out what that is. Or no matter who the group is, I know in the Smart Injury Doctors program, we have a dedicated Facebook user group. And so our doctors can come right into the Facebook user group and go type in a question. And then other doctors that are dedicated to applying this material will help those doctors to better understand the material so that they too can apply it. Being an injury doctor today is one of the most lucrative positions in the market today. And again, only the best doctors should be actually delivering injury services, in my experience. Patients have too much to lose. So commitment, it's interesting. I heard a friend of mine say, hey, this is commitment. When you're committed, let's say that you're married, right? So you're committed to your wife, or if you're a female, you're committed to your husband. Well, when you're committed to something, you don't look at something else. So you don't go straying and looking at other women or other men, because then you're getting the idea that, hey, maybe I can find something that's better. Maybe the pasture's greener over here. That's lack of commitment. Real commitment is devotion to the process, or to the thing that you're studying, or the thing that you're in a relationship with. That's real commitment. And the more committed you are, the better you're going to be in every aspect of your life. No matter what you do, you have to do it with commitment. Because if you're not doing it with commitment, then you're doing it just kind of, you're doing it as more of a hobby. And so that's especially true in injury training. If you're going to take advanced injury training, like our Smart Injury Doctors training program, if you're going to take that program, then what you want to do is dedicate yourself and commit to becoming a better doctor. As a matter of fact, today, on this podcast, I challenge you to commit to become the top injury doctor in your area. Commit to becoming part of the top 2% in your profession. Commit to actually being able to communicate as that top professional and contribute to the science, contribute to the bettering of techniques to get better outcomes, contribute to that science. And you'll become a much better doctor. But the key is commitment. You got to be committed. Now, if you're committed, you won't have any troubles with marketing. If you're committed, you won't have any problems with staffing. If you're committed, you won't have any problems with the insurers. If you're committed, you won't have any problem with yourself. Your family will be taken care of better. You'll be able to take care of it better because you're committed. So commitment is a real key in the personal injury market today. It's the key to a doctor really expanding in his ability to be a great doctor. Doctors, these podcasts are short, sweet, and to the point. If you would like, down below, I'd love to get some comments. And tell me what are you struggling with in your personal injury practices today. Tell me what you struggle with. Put it in the comments below, and I'll address it in future podcasts. Doctors, I thank you very much for taking the time to listen to me today. And as always, listen, stay tuned for the next podcast, and I appreciate your attention greatly. Thank you very much.
You've been listening to the Smart Injury Doctors Podcast, the #1 audio production show for professionals in the U.S. injury market that want to deliver better injury services to the patients, clients, or insureds they serve. If you like what you heard today, please leave us a review and don't forget to join us on our next program.